We're still recovering from one of the worst economic crises in 3 generations. And I'm not going to lie to you guys. You know it. We've still got a long way to go before everyone who wants a job can find it. I'm sure that if we travel all around here, there are a lot of folks who want work and can't find it. This has been hard on folks. It's been hard on our country. And it's going to take some time before middle-class Americans regain the sense of security that's been slipping away way before this recession hit.
Welcome back at 23 past the hour. A live look at Capitol Hill. And joining us now from Capitol Hill, Oklahoma Senator Tom Coburn with a new look this morning.
Well, I'm very distressed.
Yes, why?
Well, he shaved his beard.
Well, he looks good.
Okay.
He must have lost a bet or something. And North Carolina Senator Richard Burr joins us as well. Good to have you both on the show this morning.
Guys, thank you so much for being here. Always great to see you. Tom, we start with a tough question. Why did you shave the beard?
Oh, yeah.
Oh, it started taking longer to care for the beard than it did to shave. And the whole purpose for not shaving was saving time.
Yeah, okay. Well, when you started braiding it, Meek and I started to get a little concerned. So we're glad you're back on the straight and narrow. Well, that causes problems in Oklahoma when you go back home to town hall meetings. So let's talk about Medicare, guys. We got into a dust-up on set yesterday, day before. I said I did.
They have the Seniors' Choice Act.
With Jeffrey Sachs, and I was suggesting that Medicare and Medicaid was going to cause the biggest danger to this country as far as deficits go over the next 30 years or so. Tom Coburn, let me start with you. You've studied it. You've got a new bill out. Tell me what you know about Medicare. What's the cost curve over the next 30 years?
Well, Joe, I'm not sure I can answer it over 30 years. The unsustainable portion of it is now in excess of $40 trillion, and that's a conservative estimate. The second point is the trust fund for Part A probably is looking at being out of money sometime between 2017 and 2018, even though the official is 2022. The worst case is 2014. We're in the worst case right now. So the question really is do we have a moral obligation to ensure that a health care is provided to seniors in the future? And do we have a moral obligation to make sure our kids' future is not totally jeopardized by keeping that commitment? And Richard and I think we've got a good combination of a lot of ideas from a lot of places that will actually come forward and meet that requirement of keeping our word to seniors and at the same time taking some of the waste and inefficiency and low quality out of Medicare.
So, Richard, what do you guys do with this act to strengthen Medicare?
Well, very simply, Joe, what we do is we create choice for seniors, and we create transparency in the system. You know, it's interesting that nobody in Washington, in the executive branch, the Congress, or the government, questions whether the figures that Tom pointed to are accurate or not. The actuary at CMS says Part A is going bankrupt. The Congressional Budget Office says Medicare is going bankrupt. But nobody in Washington's doing anything. And I think Tom and I believe that we had a moral obligation to save Medicare for our parents and for our children, and to provide seniors choice in the system so that they can have a cheaper health care system, less expensive, I might say, but with a better health outcome. Now, some say we can't do it. We're willing to float it out there and try it.
So, Dr. Coburn, Dr. Dean is in the house. And I apologize for that in advance, Dr. Dean.
You apologize for me being in the house?
No, baby, I'm joking. I love you.
Yeah, here's my concern about this. I agree that Medicare is in bad financial shape and somebody needs to do something about it. But this looks a little to me like the Paul Ryan plan, which essentially shifted the financial risk from the government to the seniors. And you can talk about premium support, but of course when premium support runs into financial trouble, somebody ends up holding the bag for the 3 times the rate of inflation that medicine has gone up at for the last 30 years. So why is this not just essentially a version of the Ryan plan where the seniors end up picking the tab?
Well, it's a couple of reasons why it's not. One is we make traditional fee-for-service Medicare compete with everything else that's out there. That's number one. Number two is you get to decide what is for you. Number three is premiums are going to go up. Nobody denies that. We're all going to share a larger amount, either in Medicare taxes or in our deductibles or in our co-pays. That's all going to change. Nobody can look at Medicare and say that it's not, and to deny that that's not going to happen. So how do you do it in a way that markedly improves outcome and lowers the cost? Dr. Dean knows that $1 out of every $3 that we're spending in healthcare today doesn't help anybody, doesn't help them get well, doesn't keep them from getting sick. And one of the reasons that this will work is because it's working in Medicare Part D today. And it can work better, but it's certainly better than what we're doing today.
Jeff Greenfield.
Senators, as we enter the heated season of a presidential election, is there any chance that you can get anything like bipartisan backing for your plan?
Well, Jeff, we're at least going to try. And we understand the politics of an election year. We understand how difficult Medicare is as an issue. But we're convinced that if we can take good ideas, good solutions to our colleagues, and more importantly, inform the American people about them, that there's a real chance that we could find the bipartisan support needed to cross the goal line with an issue like this. Much of our proposal has certain points in it that are already bipartisan proposals on Medicare, and we start with a position of strength for people who are committed to Medicare reform. But we also know this is not going to be easy, especially in an election year.
I think that, Jeff, one of the key questions is why are people upset with Congress? You know, why is the trust level at such a low level? It's because the first thing we do is we put a predicate out there and say, because it's a political decision, you can't fix something. And what I think what the American people are looking for is they'd like some common sense answers that don't have your finger in the air to see which way the politics are blowing, but actually solve some problems and does it in a bipartisan way. And I think that's what Richard and I are trying to reach out and do. We hope to do that, and we think we've got a good common sense way of actually saving Medicare, improving outcomes, and controlling costs.
Mike Barnicle.
Senator Coburn, for the last 4 years, nearly the last 4 years, the country, the Senate, the Congress has taken a rapt and legitimate interest in finding out what went wrong with our financial services industry in this country, and have taken a long look at the big Wall Street banks and their role in the financial collapse. What do you think would happen if we took an equally strong look at the role of drug companies and insurance companies in the soaring costs of medicine in this country over the last 10 years?
Well, personally, from my practice and my experience in practice in medicine, I can tell you some reasons why things are going up. First of all, nobody thinks they're responsible for paying for it. The doctors who are ordering the tests, the doctors that are doing it, and the people that are actually getting the health care. It's always somebody else's bill to pay. Well, I can tell you, that doesn't work well in any economy. It doesn't work well in any type of government. So we have that underlying driver. The question we ought to ask is how do we take and get better outcomes for less money when we know a third of what we're spending is being wasted? And so what we're looking at is how do you drive that down? And number two is how do you put, the other thing we've done is how do you put some security there to know that there's a maximum of exposure you're going to have? And that's what we've done by combining the deductibles and putting a maximum hit that any one individual would have. But we do that within an income range that changes. The more income you make, the less benefit you get.
Dr. Dean.
Mike, quite simply, if we don't fix health care and Medicare is a start to it, we won't have to worry about high-cost drugs in the future because innovation will be gone. And innovation is a key part to our ability to actually cure the disease, which we realize that the maintenance of disease has become very, very expensive, not just for seniors, but for all Americans.
Well, let me just wrap this up. Tom, you said that the payments to the doctors and the costs are going up and so forth and so on. Why not just put all the Medicare recipients in a managed care program? Capitated payments. That way, you pay people to stay well, or you pay the insurance companies to keep people well, and you limit the cost to a predictable increase every year. And the truth is, and I don't mean to get too contentious here, but if you think a third of the money is wasted, about 2/3 of that third is insurance companies that are wasting it. So,
no, well, that's Dr. Dean. That's inaccurate. A third. I can give you 5 studies that show it. 1/5 of that 1/3 is tests that are ordered that nobody needs over the fact that people are practicing defensive medicine. Another 1/5 of that third is tests that are not ordered, that aren't needed, but doctors are ordering anyhow because they're not communicating with their patients, or they're ordering the test to their own benefit. So we know where this money is, but what we don't have is the proper motivation to get the best thing out of the system. The only problem with your idea is it totally takes away somebody's freedom to decide what they want to do.
No,
rather
you don't have
than
to do
us
that.
telling
That you don't have to
us
do.
telling them what they will do. And the point is when you have the market economy where you're actually involved and have some skin in the game, all of a sudden consumption goes down, and we know that.
Now, you know how, Mika,
some very different ideas here.
You do. We actually would love to get you and Tom on, and
we should.
let's talk about this for 30
In
minutes.
studio, it'd be great. It's tough this way.
Yeah, in studio,
Absolutely.
it'd be great to have you guys on. We'd make a lot of progress. Hey, by the way, you know how you know that Tom got a better education than me? Because I'm a liberal arts guy.
Well,
is when he starts breaking down fractions, 1/5 of 1/3.
Yes.
My teeth start hurting.
Yes, I mean,
and he does that, and he's like 1/16 of
You
1.
said there'd be no math to it.
I know.
I think Joe's working on me.
Yeah, he is.
Hey, one of the most important things mentioned on this show today is going to be what Tom Coburn just said. Would anybody in America please raise their hand if they know how much their flu shot cost them this year?
Exactly.
Nobody knows the cost of anything. They never ask.
Nobody knows nothing. All right, guys, thank you
Do you
so
know,
much
Howard?
for being with us. Tom and Richard, it's always great to see you guys. Come back.
Good to see you all.
All right,
God bless
coming
you.
up next, we have congressional Republicans who, of course, are saying the Democrats are being irresponsible by not passing a budget in over 1,000 days.
What's
We're
wrong with
going to
that?
bring in a good friend. He's chairman of the Senate Budget Committee, Kent Conrad. He's taken issue with that claim. Keep it right here on Morning Joe.
Message in a bottle. Oh, message in a bottle.